Where can hospice care be received? Is it anywhere? Are there certain facilities, communities, your home? Talk to us about that.
So hospice care can be received anywhere that you call home, whether that's your home, a child's home, an assisted living, a long-term care facility. Hospice can be provided there. So wherever the patient calls home is where we can go. And we can even start out in a home and say maybe it just gets a little too much for the family and they need to go to assisted living. Mm-hmm. The great thing is you have a team. So our social worker helps you be able to find a place, and we're able to go with that patient. And so they still know us. Yeah. And so they're not going into an environment they know nobody. We're able to follow them wherever they go and call home.
Yeah, to provide that extra comfort level. It really reminds me similar to when someone has a long-term care insurance policy and they're using that. What I tell my clients is it's not a location, it's wherever you call home. So if you're at home, if you're in assisted living, if you're in skilled nursing, adult daycare, it's wherever you call home. That's where you're going to receive benefits. Same is true with hospice care. So when should people start receiving hospice care or looking into hospice care, Wendi? Because I think people wait too long. So explain, what's the best case scenario?
Yep, 100%. People wait way too long, and people don't realize they're paying into this benefit their whole life.
Yeah.
So I always tell people when they start seeing a decline, whether that's weight loss, maybe that's even them isolating from activities that they used to be part of, going in and out of the hospital a lot, falls. I mean, any decline that you really see, I always say it never hurts to call up hospice and say, hey, because what happens is a nurse needs to come evaluate, and then a doctor has to say they're eligible for the hospice benefit.
Okay.
So it does not hurt to get an evaluation. It's completely free. What's great is if you start realizing a family is falling or declining in health and you ask for that hospice eval, even if they're not eligible, we now have a baseline to go off of.
Yeah.
And my job as a patient navigator is to call that patient or family every 30 days if they don't qualify. Say, hey, how are things going checking up? And if you're like, Dad's really declined since you guys been out here 2 months ago, well, now we have that baseline to go off of.
Yeah.
And so that really helps also to be our nurse. I just had a patient the other day, the nurse went out a couple months ago. And when she went back out this last week, she saw that decline in that patient and could vouch like, hey, this was the baseline. Now here where we're at, they really need that extra level of care.